at UCR Health. And this conversation that we're going to have is going to be a pediatric potpourri of frequently asked questions by parents, and there will be a back and forth. So just as an overview of the talk, we're going to have a UCR Health video. I'm going to give you my background and give you the agenda for the talk. And we're going to be doing some polls, parent polls, as we go through some 15 commonly asked questions for the American Academy in healthychildren.org over the last few months. And we'll be using Poll Everywhere. And we're going to go over the answers, give you some conclusion and thanks, and answer any questions, give you some resources and coming events and a survey.
Welcome
Do we hear?
to UCR Health. We see our mission in action every day.
Good.
Through a dedicated team of physicians and healthcare professionals, our unique care delivery model has revolutionized and redefined what it means to serve Riverside and Coachella Valley, because we are inland Southern California. Quality care, it means different things to each of us, but it's at the core of what we do. We're teaching the best and the brightest how to heal, educate, and empower those we serve. It means delivering high-quality primary and specialty care at the right place at the right time. Because we are UC Riverside Health. Because this is our community. Because we are healing the Inland Empire. And we all have a role to play in keeping our community healthy right now and into the future. We care together and improve lives together, because health starts with you and with me.
It's caring for your little one as if they're our own. It's training the next generation of physicians to take care of our community.
It's knowing I've helped a generation of community members.
It's helping.
Can you, did it stop?
Yeah, it stopped.
The grandmother's heart beat stronger than ever.
It's making your body yours again.
It's caring for your mind with my whole heart.
It's showing the diverse faces of our community they are not alone.
Because health starts here.
Because health starts here.
I am UCR Health.
मैं UCR Health हूँ.
Yo soy UCR Health.
And together, we are UCR Health. Join us, because health starts here.
Very memorable.
Welcome to UCR.
Okay, a little bit about myself. My philosophy is that it's important to maintain composure and be very clear-headed to make good medical decisions. I prioritize comfort of children and kindness as well as compassion. My background is as a pediatrician, pediatric ID doc with more than 25 years of experience here at UCR Health. And I'm affiliated with 4 well-known area hospitals, and I work at Citrus Towers here in Riverside. So our agenda is to do a pediatric potpourri of parent questions. And it's going to be a poll. The first question is, can vitamin A prevent or cure measles? Very timely topic. And so now, guys, what you're going to do is scan the QR code, and I will see your responses. So go right ahead. Can everyone hear me? Can everyone hear me?
Yes, we can hear you.
Okay, very good. So go ahead and scan the QR code. You don't have to put in your name or register, because it's not a formal test. but you can just actually answer without putting registration.
Having some issues. Is anyone else? I don't know why I can't scan it. Maybe it's my camera.
So what you have to do is go really close to the scanning thing, because then it'll take you to the Poll EV website. The first one can be like a test run. What you do is you go really close, because then it'll give you the website below, and then it'll take you there. If there's a problem for scanning, type in pollev.com/RoopaXU. Tell me when everybody is ready to move forward. Cool, we
That
got
worked.
a third person. Yay.
Yeah.
So let's go through it, guys. As people start getting more comfortable with it, more people will answer. So the response, you guys did the response. You see the responses and the correctness. So that's the answer. It's no. And why is because vitamin A does not prevent or cure measles directly. But if you're a child and you have contracted measles, if you take a supplement, you may reduce complications such as pneumonia or blindness. And it's important in populations where vitamin A deficiency is common, and especially in developing parts of the world. And the most effective way to prevent measles is through the vaccine, which is very effective and very safe. First dose, 95%. Second dose, 97%. Very effective. Okay. Next question. Is baby formula safe? I'll have you guys scan and go. Someone's really tech savvy. They jump right on. Second person has answered. Awesome. Okay. Awesome. People are now starting to get comfortable with this. Awesome. Awesome. So let's look for correctness now. Okay. And why is that? Yes, baby formula is safe. It's when it's commercially manufactured and it's prepared according to instructions. And the FDA regulates it because it's a food. And don't make homemade formulas, which may lack essential nutrients, may cause health risk, may have electrolyte imbalance, may cause infection. Always follow. Remember, these little ones are very fragile. So we don't ever want to do anything, never want to shoot from the hip. Always follow preparation storage guidelines closely. Okay. Next question. My baby has a stuffy nose. How can I help them sleep safely? So these are our answers. Back sleep, use saline with the suction apparatus, or tummy time sleep and feed them Sudafed in a syringe. Awesome. And the correct answer is back sleep. We never want to sleep on our tummy under 1. We don't want to give Sudafed to small children. It can race their heart. and it's not approved and is highly restricted under 5. Okay, so for a stuffy nose, help them sleep. Safe sleep practice. Use the saline, loosen their mucus, use a bulb or nasal aspirator. Keep the air moist, use a humidifier. Place the baby on their back. Nice, flat, firm surface, nothing too loose or soft around them. Okay, next question. Can CMV cause hearing changes in infants? Okay, guys, let's go. Okay. It's a hard question, so let me just give you the answer. Yes, it can. CMV is one of the leading causes of non-genetic hearing loss in children. It can be transmitted during pregnancy. It can be very symptomatic at birth or have a delayed onset hearing loss. And infants should be monitored for changes in hearing. There are some early interventions like hearing aids, but now we actually have antivirals that we can treat children and prevent them from getting hearing loss and language and developmental outcomes. It's a success story of some antivirals. So yes. Okay. My teen is having trouble falling asleep at night. How can I help? The answer is encourage sleep hygiene. Give a daily nighttime dose of Benadryl. See how other people are responding now. Okay, guys, let's see what the answer is. So good sleep hygiene is the answer. They struggle with sleep sometimes because of biologic changes and some lifestyle factors. So really encourage your teen to go to sleep and wake up at the same time daily. Easier said than done, even on weekends. Limit the screen time to an hour before bed. The blue light really disrupts them. It affects the melatonin production. Avoid caffeine in the afternoon and evening. Create a calming bedtime routine and ensure that the room is quiet, dark, and cool. How do I keep my children safe and warm during winter power outages? And we went through this in January, if you remember, in Riverside. So the answers are dress them in layers and use blankets or sleeping bags for warmth, or use candles for lighting. Okay, so the correct answer. Dress them in layers and use blankets or sleeping bags for warmth. Okay. During a winter power outage, which we're familiar with during the fires, keep children dressed in layers, stay in a single, well-insulated room to conserve heat. Battery power lights are preferred over candles to avoid fire hazard. Don't use gas stoves or outdoor grills indoors. if you're using a generator, make sure it's operated outdoors and away from windows to prevent carbon monoxide poisoning.
I think that's fine.
Okay. Poll number 7. How should we feed our baby if we're running low on money? Okay, the answers are dilute for formula, or reach out to resources like the Special Supplemental Nutrition Program for Women, Infant, and Children, also known as WIC. Reach out to local food banks, reach out to your pediatrician for some any extra supplies. Okay. Correct answer. Right there. If you're facing a financial hardship, do not dilute the formula or make your own at home. Remember, reach out to resources because children are very fragile and they can become underweight if formula is diluted, and they can have serious electrolyte imbalances if there's not a balance in the food that is being provided. So WIC, local food banks, and we may have samples as well so that we can maintain good nutrition for children. And then next poll, why is my baby always getting diaper rashes?
If you continue to have a
Yeah, definitely, yeah.
Is it because diaper rashes are common and cause prolonged exposure to wetness from irritation, from friction, sensitivity? And or is it genetics? 1 second, guys, 1 second.
Antonio and I think yeah.
Second.
enjoy your time.
I'll do my best. They gave me 8 nights. How do you doing 8 nights at San Gregorio?
Yeah.
It's a long drive though.
It is. It is.
Have you been there? But then you know.
I know.
Okay, I'll
Hey,
go.
hey,
So
you
it's
there.
common,
It's from
can be
Take
from
care.
prolonged exposure to wetness or irritation. Maybe it's sensitivity, maybe it's urine friction. But you can prevent rashes by changing diapers frequently, gentle cleaning, using a good barrier cream. Sometimes you have to use a thicker cream if some kids are more sensitive. And you can even do some air drying and without a diaper if to help the skin heal. And if it persists, then you can see one of us. And then the next question, when should I introduce wheat into my baby's diet? Either you can introduce wheat typically around 6 months of age or after 18 years. That would be best. What's the answer? And the correct answer is with the foods that are introduced slowly but surely after 6 months of age. Sweet is part of that introduction of solids. And you do 1 at a time every 5 to 7 days to make sure there's no allergic reactions. And you do this in this kind of sequential way. And you do it in small amounts and you look for reactions and for rashes, vomiting, and diarrhea. And if you're at risk, you do 1 at a time. Okay, next question. Should I let my child watch scary movies? Age-appropriate media, or the scarier the better, which is the answer. Let me show you the answer. There you go. Yeah. Scary movies can be distressing to children. They can cause nightmares. It can be anxiety provoking or fears and affect your daily function. Consider the child's age, temperament, and sensitivity. And some people may struggle to distinguish fiction from reality. Instead, offer age-appropriate media and help them process and understand the content. Okay. What should I know about recalled baby formula? If baby formula is recalled, stop using it immediately. Check with the manufacturer. Go to the FDA site for instructions. Or don't worry about it. And the answer, good job, guys. Next one. So if a baby formula is recalled, stop using it immediately. Check with the website and the FDA. And they can happen due to contamination, labeling, nutritional imbalances. And if there's a concern that a child has consumed the recall product and shows any illnesses, please present to your doctor. Okay, what's the best way to protect children's skin from sunburn? Apply a broad spectrum sunscreen with SPF 30 or higher. Don't allow them outdoors at all. Perfect. Awesome. To prevent sunburn, apply this nice broad spectrum sunscreen, SPF 30 or higher, right a few minutes before going outside, and reapply it every couple of hours. Dress them in lightweight, long sleeve clothing, wide brimmed hats if it's hot. Stay in the shade if you can, and under 6 months should be kept out of direct sunlight. Poll number 13. Is it okay to need a break from my kids? Needing time to rest and recharge is normal and healthy. No breaks? What breaks? The answer is the first one. It's not letting me show the last answer. Glad we're almost done so that auto hide controls is not letting me share that view anymore. Sure why. But it's the first answer. Parenting is very demanding and we need time to rest and recharge, and it's normal, it's healthy. And maintain your emotional well-being by taking breaks. It helps us parent better. If you're feeling overwhelmed, seek help from your support system or a mental health professional. Self-care is not selfish, it's essential. Okay, what should I do if my child or teen is thinking about suicide? Take or talk or signs of take any talk or signs of suicide seriously. Don't leave your child alone. Seek immediate professional help. Contact your pediatrician. And then the opposite, don't take it seriously. Of course, you guys got all of these correct. Take it seriously. Don't leave them alone. Contact people. Use the suicide crisis line. Listen non-judgmentally. Remove access to means of self-harm.
Progress is good.
Yeah.
What progress has she made?
She brought in everything you asked for. She brought in the water, the blood pressure, as well as the.
Then the last poll, how do I help my picky eater try more
Well, we
healthy
knew that.
foods?
We knew that. Okay, so
But, so the numbers are basically like. I think
Help a
1,
picky eater.
42,
Helping a picky eater involves patience and consistency. Offer new foods along family favorites without pressure. Involve your child in grocery shopping. And then offer Lunchables daily.
the other one.
Looks like you guys got the correct answer. It's not letting me go into a mode where I can share the answer with you guys, but it's the first answer. So patience is very important as a parent. Keep offering new foods with their favorites without pressure, and take them with you for grocery shopping. Help them get involved in your meal prep so they develop an interest in food. Make it a positive eating environment. Family dinners are wonderful. They really help. And help the children by avoiding negative comments. Takes a lot of exposure sometimes before a child accepts a new food. That's very normal. Okay, I think everyone is thinking, let's stop now. And let's take a breath. And I wanted to thank you guys for your attention, for CC for inviting us, Miss Eileen Kwan, Miss Soyeon Jin, and UCR Health for the slide content review and technical expertise, Miss Monica De Dios for CC for the slide content review and technical expertise, and Mr. Guy Stoyle from UCR, who taught me how to use Poll Everywhere, and my son Sid, who fine-tuned it for me. And the resources were healthychildren.org generated parent questions. And I'm happy to answer any questions, and just want to let you know that we're doing a meet and greet on May 28th.
Well, thank you so much, Dr. Roopa. While folks are considering dropping in their questions either in the chat or unmuting themselves to raise these questions now, as Dr. Roopa said, we highly encourage you to do so. This is your time to really engage and, ask, as you can see, a huge range of questions under the sun, and many thanks to Dr. Roopa for addressing all of them. So while that's happening, I'm curious, Monica, if you had any details around the location for the meet and greet, or if that information will be shared at a later point in time.
Yes, so the meet and greet for next month's meeting will be here in the North Center in our conference room. So we'll have it here and we'll host it here at 4 p.m. as well.
Wonderful.
We don't have a QR code attached to it. So would you be able to send out a Zoom link for that?
Yes, I can do that.
That way we can look at the location as well for our Google Maps.
Yeah.
And then the survey, tell me how we can get the survey out for everyone.
Monica, I think that's for you.
Yeah.
Will we be able to drop the survey into the chat?
Yes. Let me get the survey for you. Give me one.
And since we have a bit of time remaining, I'd love to encourage everyone to go ahead and fill that out, both not just for our incredible physician lecturer who has taken time out of her day to pull together this wonderful content for us, but also for UCR Health as we continue to explore different partnership opportunities with CC. We always like to know, is the information valuable? Is the format useful? So please do us a solid. I know I see a couple of repeat names here. So if you've attended not just this one but also prior sessions last month or the month before, we ask that you please go ahead and complete the survey for us. And we'd really, really appreciate it. I'll go ahead and stop recording, but thank you so much, Dr. Rupa, for taking your
Thank
time.
you.
And we will go ahead and post this entire recording onto our YouTube. And we ask that you please, if you have friends and family in your network that would that could benefit from some of this information, please do share it. Share the link, share our YouTube. You can find us at UCR Health. And yeah, all of the prior webinars have also been posted directly to that channel. So please take time to access it. It's wonderful that we have access to this great wealth of information and knowledge via Dr. Rupa. So do yourself a favor and get informed. So thank you so much for that. And I think we have, I'll just pause there and open it up. Parents, caretakers, anyone have questions for Dr. Rupa that you want to raise?
Oh, it looks like Monica's raising her hand. Oh, Monica's saying goodbye to the children.
Okay. And Monica, are you able to drop the link in? Perfect.
Yes, just dropped it.
Wonderful. And hopefully we can get others on board to fill this out. Maybe we send another